Hello viewers, I am Tita Fatari and today we are going to be diving deep into the chapter 4 and 5 of the McGraw-Hill's EKG textbook. I'm going to be putting a photo right there so you can know the textbook, and if you have it or for any reason you're here, I am assuming you are trying to pass your EKG, your CRAT or your CCT exams, and that is why I am here today. We will be covering over 100 questions and answers from the chapter 4 and 5 chapter reviews and checkpoint questions. This chapter covers the core topics of EKG. It covers the anatomical landmarks, the leads V1 to V6, the lean leads, pediatric or infant modifications, artifacts and causes, safety and patient management, electrical events, components of the ECG waves, the 5 questions for rhythm interpretations, segments and intervals, waveform morphology, and condition identified. Let's get into it. Name 4 important aspects of preparing for the ECG procedures. Number 1 would be verify the patient's information, explain the ECG procedure to the patient, ensure the correct physician's order and requisitions, and prepare the equipment to ensure the patient's privacy. Those are the 4 aspects of preparing for the ECG procedures. Question 2. What information must be included on the ECG requisition? Answer will be patient's full name, date of birth, medical records, ordering physician name, reasons for ECG or diagnosis, and the date and time of ECG performed. What should you indicate to the patient when closing the door or pulling the curtains before performing an ECG? The answer will be tell the patient you are providing privacy and preparing to start the ECG procedure. Question 4. What should you do if a patient refuses an ECG? Answer. Respect the patient's refusal. 2. Ask the question why for their refusal. Notify the supervising nurse and document. Number 5. Name at least 3 things to do to ensure safety during the ECG procedure. 1. Use proper body mechanics when moving equipment and patients. 2. Ensure the machine and cords are not damaged and are safely positioned. 3. Wash hands and use standard precaution as needed. Use your gloves if needed. 4. Make sure the patient is stable and positioned safely on the exam table. 6. What is the purpose of maintaining good body mechanics? The answer would be to prevent bone and muscle injury on yourself and the patient. Number 7. What anatomical landmark starts in the middle of the axilla and runs down the side of the chest? The answer is the mid-axillary line. Number 8. What is the angle of Lewis? The answer is at the sternal angle, the junction between the manubrium and the body of the sternum located at the second level of the second rib. 9. How can you be certain you are attaching the lead wires to the electrodes properly? Answer. Ensure each lead wire snaps firmly onto the electrode. Match the correct color, label, and is secure without loosening. 10. Why should you place the limb electrodes before the chest electrodes? The answer. To ensure proper grounding, stabilize the ECG machine, and reduce artifacts. 11. What must be done before you run the actual ECG tracing? Answer: ensure proper electrode placement, confirm skin preparation, make sure all leads are attached properly, verify the ECG machine is standardized and calibrated, and ensure the patient is still and relaxed. 12. Describe how to run the ECG machine to create the lead tracings. Answer: press the run or record button. Allow the machine to automatically record all 12 leads. Ensure it prints steadily, artifact-free complexes. Then stop the recording once the machine completes the cycle. What is the most likely cause of the artifact in the diagram? And that would be AC interference. 14. Name 3 causes of wandering base. One would be loose or poorly attached electrodes, oil, lotions on the skin of the patient, and patient moving or breathing. Those could be reasons for wandering baseline. 15. Another would be expired electrodes. 15. How should you report a stat ECG? The first thing you should do is you must immediately notify the nurse or the physician in charge immediately you are done with the ECG procedure. Why is it critical to enter the correct and complete data into the computer when performing an ECG? The answer to that will be because incorrect patient data can attach the ECG to the wrong patient. It can delay diagnosis or treatment. It can create legal and medical record errors, and it could affect billing and documentation accuracies. Those are the 4 possibilities. 17. Why should you know how to troubleshoot and maintain the equipment for an ECG? And that is because the answer to that is because you want accurate tracing and also help with prompt treatment and diagnosis of patients, signifies you and the organization you work for as professionals, and prevents legal problems or medical complications to you or your organization. Also, it extends the life and safety of the ECG machine. 18. Why do you frequently need to adjust the proper speed of 50 millimeter per second for infants and small children? The answer to that is because children have very fast heartbeat, so the paper speed needs to be around 50 millimeter per second to spread out the waveform so they can be read and interpreted accurately. 19. When you change the paper speed to 50 millimeter per second, what else should you do? The answer will be you must document the change. 20. What is the difference between continuous cardiac monitoring and a routine ECG? Continuous cardiac monitoring monitors the heart rhythm in real time using 3 to 5 leads and doesn't produce a full diagnostic 12 ECG, while the routine ECG, which is the 12 lead, gives a full 12 lead diagnostic ECG because it makes use of the 12 leads. It is not continuously monitored. 21. Describe the process for recording a right side or posterior ECG. You move the precordial chest lead to the mirror image right side for a right-sided ECG, e.g. V4R, V5R, and V6R. 2. For posterior ECG, place additional posterior leads V4, V7 to V9 on the patient's back along the left posterior axillary and scapular line. Record the tracing and label it clearly as right-sided or posterior to avoid misinterpretation. 22. What additional ECG procedure may the doctor order for a patient with dextrocardia, and why? The answer would be a right-sided 12-lead ECG. Because the heart is located on the right side, normal lead placement would produce incorrect or inverted waveforms, so all chest leads must be moved to the right. 23. What should you do if a patient has a seizure while you are starting to record an ECG? These are the following steps you would take. You stop the procedure immediately. You ensure the patient's safety. Do not restrain the patient. Call for medical assistant. And after the seizure ends and the patient stabilizes, you may repeat the ECG and note post-seizure. The next series of questions will be matching. So we have 4 questions matching super notch. So number 1, suprasternal notch will be D. 2, fifth intercostal space. The answer is B. 3, manubrium. The answer is C. And 4, right clavicle. The answer is A. So if you got those 4 right, you're doing great. Thumbs up. And if you didn't get it right, there is no problem. This is a recorded video, so you can always go back and rewatch. To download the study guide chapter 4 and 5, you can click on the description down below and you can use it to study furthermore. Also, you can use it to create your own question banks. Match 2, lead incorrect placement. An error was made during recording, but that doesn't stop us from continuing with our quiz. So this talks about the precordial lead placements. Question 5 through 10, which is V1 through V6. V1's answer is E, fourth intercostal space, right sternal border. V2, number 6, is B, fourth intercostal space, left sternal border. Number 7, V3, is F, halfway between V2 and V4. Number 8 is D, V4, fifth intercostal space at the mid-clavicular line. Number 9 is V5, A, fifth intercostal space, anterior axillary line. And number 10 is V6, which is the fifth intercostal space, mid-axillary line. So number 11 is C, mid-clavicular line. Number 12 is B, mid-axillary line. While number 13 is anterior axillary line, which is A. So number 11, can you guess what lead goes on number 11, 12, and 13? Number 11 is V4. Number 12 is V6, while number 13 is V5. Number 14, for placing of electrodes, for placement of the electrode, how is the ICS located? Go through the 4 options and tell me what the answer is. If your answer is C, locating the clavicle and feeling for a dent directly below it, you are correct. 15. First and most appropriate thing to say if a patient refuses an ECG, what will that be? The answer is A. Will you tell me why you don't wish to have an ECG done? Number 16. When applying chest leads, V4 is placed where? The answer for that would be the fifth intercostal space, mid-clavicle line of the left chest. If your answer is C, then you are correct. Number 17. When applying chest lead, V2 is placed where? If your answer is D, at the fourth ICS, left sternal butter, you are right. 18. To prevent disease transmission during an ECG, what must you do? The answer from this 4 option is wash your hands. B. 19. Which would not be done prior to performing an ECG? The answer is C. Check the paper. Check if you need to refill the paper. 20. When applying chest leads, V1 is placed where? You are correct, at the 4th intercostal space, right sternal butter. 21. Marks on the ECG tracing caused by another source of activities are called what? If your answer is C, artifact, you are correct. 22. Somatic tremors are caused by? The answer would be C, muscle movement. 23. Correcting wandering baseline, which would be the answer? The answer to this question is D. All of the answers are correct. 24. If lead 1 and 2 have a lot of artifacts, what electrode is likely misplaced? Let me give you a hint. So what is lead 1? Left arm, right arm. What is lead 2? Right arm, left leg. Which one is common? The right arm. So the answer is right arm, which is option A. If you chose something different, please use and refer back to your Einthoven's triangle. I would make a very short and quick video on that later on. 25. Correcting AC interference, what must you do from these 4 options? The answer will be unplugging electrical equipment and moving beds away from the wall. That is A. 26. Correcting somatic tremor. What is the right answer from the 4 options? The answer is C. Have patient place hands underneath the buttock. Remind the patient to be still and not to move. 27. Correcting wandering baseline. The correct answer is B. Apply electrodes securely, remove tension from lead wires. 28. V6 placement. The correct answer is A. In line with V4 on the mid-axillary line. 29. Patient with left leg amputation electrode placement. Where should it be placed at? That means the left leg was cut off. Where should the placement of the electrode be at? The answer should be D. Left leg on lower left abdomen and right leg on right lower leg. 30. When performing 12-lead EKG on infant small child, all except which? The exception, when it says exception, what should you not do? The answer is D. Use a special machine, ECG machine. 31. Approach the patient from the dash when performing an ECG. What would be the correct answer? If your answer is left, you're completely wrong. Approach a patient from the top. C. 32. Natural skin oil moisturizes and perspiration can contribute to artifact on a ECG tracing. True or false? The answer is true. 33. Letter R is placed after any tracing when the electrode is not in its usual position and has been placed on the right side of the patient's chest. Yes or no? True or false? True. Remember, when there is a modification or a change in the placement or any kind of occurrence that happens during an ECG procedure, it must always be documented on the ECG result. 34. Intercostal space means what? The answer is D, the space between the two ribs. 35. Mid-axillary line is what answer? H. Imaginary vertical line starting in the middle of the axilla. 36. Stat. What does that mean? The answer is K. Immediately. So when you hear the word start, it is immediately. Immediately. Vite, vite. Immédiatement. 37. Anterior axillary line. The answer is M. Imaginary vertical line starting at the edge of the chest where the axillary region begins. Here, talking about the edge of the chest. 35. Artifact. The answer is I. Unwanted markings on the ECG tracing caused by electrical source. And when it is electrical, what type of artifacts are we referring to? Correct. AC artifact. AC interruption. My bad. 39. Seizure. The answer is A. Interruption of electrical activities of the brain causing involuntary muscle movement. That is seizure. 40. Mid-clavicular line. You should know that, don't you? Number 40, mid-clavicular line is the imaginary line running vertically through the midpoint of the clavicle. That will be E. 41, somatic tremor. I don't know, whenever I hear somatic tremor, the first thing that pops in my brain is like muscle, especially with the tremor. Like, people who drink coffee and, they have this tremor. Like those who have had like years and years of drinking coffee and their hand just can't stand still like this. It just goes this way. So whenever I see somatic tremor, I just think of muscle. So somatic tremor, L, involuntary or voluntary muscle movement. So body tremor. It's also a type of artifact. 42, angle of Lewis. 42, angle of Lewis. The answer is B, bony prominence 1 inch below suprasternal notch where the manubrium and sternum join. 40. I really deeply apologize for the barking. It's our neighbor's dog and his name is Jack. He's a very big sweetheart, but doesn't necessarily. So please tolerate his barking. I feel like he's joining our class. Good job, Jack. 43, AC interference, and that would be unwanted marks on ECG from electrical sources.
Jack's announcement. Tutor Futari messed up this section and says you should take screenshots for the correct answers or download the study guide. Thank you.
So 44, wandering baseline. The answer would be F, drifting ECG baseline away from the center of the paper. 45, sternal border. What is that? The answer is C, outer edge of the sternum. 46, dextrocardia. The answer is N, condition where the heart is on the right side of the chest. Don't forget, most of the time the heart is located on the left side of the chest, most of the heart. But in this situation, some people's heart is located more to the right. 47, mid-scapular line. The answer is J, imaginary vertical line on the back and starts in the middle of the scapula. 49, identify each lead and describe its correct 12-lead placement. A repetition, V1 through V6. So the V1 is the intercostal space, right sternal border. V2 is right sternal border. The V2 is intercostal, right sternal border. Right. Okay. V2 is V2, fourth intercostal space, left sternal border. V3 is midway between V2 and V4. V4 is mid-clavicular line, fifth intercostal space. V5 is anterior axillary line, fifth intercostal space, and V6 is mid axillary line, fifth intercostal space. 50. Flatlines while performing ECG on a coma patient. What is the first thing you do? If you find a flat line performing an ECG on a coma patient, what must you do? First of all, you must ensure that the electrodes are properly placed, especially the one on the right leg, which is called the ground lead, because wrongfully or not properly placing that could actually also lead to a flat line. So you want to make sure that every lead is properly placed and make sure you check on your patient. First thing first, check on your patient. Then verify that the leads are properly placed and verify also for the right leg so you do not get a false asystole. 51. Parkinson's disease. What artifact and how to reduce this? A person with Parkinson's disease will have somatic tremors because it has to do with muscle movement. So the best way to handle the situation is have the person place their arms underneath the buttocks so that you can achieve a clean ECG. So you can achieve a cleaner ECG reading. 52. Patient begins to complain of chest pain during ECG. What do? What you do is you stop the ECG and you notify your nurse or your physician immediately. Don't wait for your next breath. Make sure you stop your ECG and get the nurse or the physician immediately. 53. Patient asks you for a copy of the ECG. What do? So the first thing you do is you must follow the facilities policy. You explain that you're just there to perform the ECG procedure and tell them that their physician or the nurse will follow up with the results and more explanation on the ECG performed respectfully and ethically. Chapter 5. So question number 1, which electrical event normally results in contraction of the heart? So where does most contraction happen on the heart? It will be the ventricles. So that would be ventricular depolarization. Which wave represents the atrial depolarization and the ventricular repolarization? The P wave represents the atrial depolarization, while the T wave represents the ventricular repolarization. The QRS represents the ventricular depolarization. 3. What is ischemia? Ischemia is a lack of adequate blood and oxygen to the heart muscles. Period. 4. What is evaluated and classified when determining these rhythmias? So there are about 5 things to check for. So we have the heart rate, the rhythm regularities, the P wave morphology, the presence of every P wave for QRSs, the QRS complexes, and PRI intervals. So those are the 5 things. What are the 5 things? The heart rate, the heart rhythm, the PRI, the P wave morphology, and the QRS complexes. 5. Name the 5 components that may be evaluated on a rhythm strips. Those are the 5 same thing. Let's go over it again. So we have the heart rate, the rhythm, the P wave morphology, the QRS morphology, and the PRI. 6. A regular rhythm has 19 small boxes between 2 consecutive P waves. What is the heart rate? The way to measure this is we use the 1,500 method. So 1,500 divided by 19, and the answer is 79 beats per minute. Do not forget, even when there's a decimal point, because I think the answer goes like 78.7 or 8. So what you do is if it's higher than 5, you approximate it to round it up by 1, but if it's lesser, so if it is, for example, 78.1, then that's 78 beat per minute. But if it is 78.6, 78.7, then you round it up to be 79 beats per minute. 7. After you measure the QRS duration and morphology, what other questions need to be answered? Number 1, is there a P wave for every QRS? Number 2, is the rhythm regular or irregular? Number 3, do the rhythm fall between the normal limits? Number 4, are the waves consistent and normal in appearance? Another multiple question. The PR interval is usually between 0.12 to 0.20. Do not forget, PRI 0.12 to 0.20, and that will be option B. 11. What part of the ECG represent repolarization of the Purkinje fibers? The answer is U wave. That's option C. 12. What part represent time from atrial activity to the start of ventricular activity? The answer is PRI. The PRI starts from the beginning of the P wave and ends just at the beginning of the QRS. Complex. 13. What part is measured from the end of S wave to the beginning of T wave? The answer is ST segment, which is A. And what question does not need to be answered when determining QRS measurement? The answer is D. Is the PR pattern irregular? You don't need that. A QRS complex greater than or equal to 0.2 seconds indicates what? The answer is B, delayed ventricular conduction. Question 18 has to do with labeling the parts of the waves, complexes, intervals, and segments on an ECG strip. If you want to take a screenshot, that'll be good. Else, do not forget to download the study guide like I mentioned earlier in the description box below. So, download the study guide. That part. So number 19, this would be our last question for today. If you have made it to this point, I am so proud of you. Well done. And I wish you good luck in your ECG, your CRAT, or your CCT exam. 19. Describe the reading strip interpretation process to a friend. How do you describe it to a friend? I'm just going to read it from how I wrote it here. Rhythm strip interpretation is a step-by-step process where you measure and examine the heart rate, determine whether the rhythm is regular, evaluate the P wave morphology, evaluate the PRI, and also evaluate the QRS morphology. You analyze these 5 components to figure out where the heartbeat is originated from or whether there is, and also to figure out if there is an upcoming, underlying, or previous problem in the heart activities. This helps you figure out MIs or any type of dysrhythmia, which could be very fatal. So this is the end of today's chapter review, chapter 4 and chapter 5. And like I mentioned before, make sure you download the study guide in the description down below. Make sure you are following, subscribing to this channel, as I will be doing more reviews from the McGraw-Hill's EKG textbook. I have taken time to read the textbook, and I figured out that while writing my CCT exams, which I kind of failed on my first sitting, I didn't kind of fail it. I actually did fail that exam, Yeah, I did. And failing that exam pushed me to read the book, and I realized that a lot of questions while writing my EKG and my CCT did come out from this book. So I'll be doing a lot of reviews and chapter reviews from that book, complete from chapter 1 to 15. So make sure you are following, subscribing, and turning on your notification bell so you will know when next I upload. Not only that, I will be making short videos explaining certain things that has been misconcepted or easily forgotten in your EKG. So, toodles.